If you're pregnant or planning to be pregnant, this video is for you. Today we're going to talk about congenital abnormalities. But what are congenital abnormalities? Congenital abnormalities are also known as birth defects. So these are structural or functional differences that occur during prenatal development. So these abnormalities can affect any part of the baby's body and may have mild or severe effects. Here are some of the common congenital abnormalities. First, we have structural abnormalities. These include cleft palate, heart defects, spina bifida, limb deformities, and Down syndrome. Number 2, we have functional abnormalities, which include metabolic disorders, hearing loss, and vision problems. Let's talk about the risk factors to congenital abnormalities. Number 1, we have genetic factors. This includes family history of congenital abnormalities and also genetic mutations. Number 2, we have environmental factors. So exposure to certain substances during pregnancy, such as alcohol, drugs, and some infections. So these ones can also lead to congenital abnormalities. Number 3, we have nutrition factors. So poor nutrition during pregnancy, such as lack of folic acid, can also lead to congenital abnormalities. Number 4, we have maternal age. So women over 35 years have a high risk of having a baby with a congenital abnormality. So what can we do to prevent congenital abnormalities? Number 1, we have taking folic acid. So women who are pregnant or those who are planning to become pregnant should take folic acid supplement to reduce the risk of neural tube defects. Number 2, we have avoiding alcohol and drugs. So pregnant women should avoid alcohol and drugs, as this can increase the risk of congenital abnormalities. Number 3 is getting vaccinated. So pregnant women should get vaccinated against certain infections such as rubella, which can cause congenital abnormalities. Number 4 is maintaining a healthy weight. So women who are overweight or obese have a higher risk of having a baby with a congenital abnormality. Number 5 is managing chronic conditions. So women with chronic conditions such as diabetes should work with their doctors to manage the conditions before and during pregnancy. You should remember it's essential to consult with a qualified healthcare professional for any health concerns about congenital abnormalities before making any decision